Thank you for joining Drug Free Workplace PA. Today we will be discussing prescription opioids versus heroin, opioid use disorder, and resources. The first known cultivation of the poppy recorded in Mesopotamia was in 3400 BC. Some prescription opioids are made directly from the plant, and others are made in laboratories using the same chemical structure. Of all the nations of the world, America consumes the most opium in one form or another. The habit has this nation in its grip to an astonishing extent. The drug habit has spread throughout America until it threatens us with a very serious disaster. Opioid misuse is not new to the U.S. President Roosevelt appointed the first drug czar in 1908. The latest data from the Substance Abuse Mental Health Association reports that in 2019, opioid use disorder decreased from 2 million to 1.6 million. Efforts to increase medication assisted treatment, psychosocial, and community recovery supports have had a positive effect. Heroin initiation decreased significantly with a 57% decline from 2018. Despite gains, opioid overdose deaths increased in 2019 by approximately 4.6%, with the increased risk of potent illicit synthetic opioids and the continued need to engage people in treatment and recovery services. Opioids bind to and activate opioid receptors on cells located in many areas of the brain, spinal cord, and other organs in the body, especially those involved in feelings of pain and pleasure. When opioids attach to these receptors, they block pain signals sent from the brain to the body and release large amounts of the feel good chemical dopamine throughout the body. This release can strongly reinforce the act of taking the drug, making the user want to repeat the experience. Opioids can remain in your system for 1 to 3 days after the last use. Synthetic opioids, including fentanyl, are now the most common drugs involved in drug overdose deaths in the United States. In 2017, close to 60% of opioid related deaths involved fentanyl, compared to 14% in 2010. When prescribed by a doctor, fentanyl can be given as a shot, a patch that is put on a person's skin, or as a lozenge that is sucked like a cough drop. The illegally used fentanyl, most often associated with recent overdoses, is made in laboratories. The synthetic fentanyl is sold illegally as a powder, dropped onto a blotter paper, put in eyedroppers and nasal sprays, or made into pills that look like other prescription opioids. Some drug dealers are mixing fentanyl with other drugs such as heroin, cocaine, methamphetamine, and ecstasy. This is because it takes very little to produce a high with fentanyl, making it a cheaper option. This is especially risky when people taking drugs don't realize they might contain fentanyl as a cheap but dangerous additive. They might be taking stronger opioids than their bodies are used to and can be more likely to overdose. Heroin is an opioid drug made from morphine, a natural substance taken from the seed pod of the various opium. It is estimated that about 80% of people who use heroin first misused prescription opioids. More recent data suggests that heroin is frequently the first opioid people use. In a study of those entering treatment for opioid use disorder, approximately one-third reported heroin as the first opioid they used regularly to get high. People who use heroin report feeling a rush or euphoria. Other common effects include dry mouth, heavy feelings in the arms and legs, and clouded mental functioning. Long term effects may include collapsed veins, infection of the heart lining and valves, abscesses, and lung complications. Heroin can lead to addiction, a form of substance use disorder. Withdrawal symptoms include severe muscle and bone pain, sleep problems, diarrhea and vomiting, and severe heroin cravings. People who inject drugs, such as heroin, are at a high risk of contracting the HIV and hepatitis C virus. These diseases are transmitted through contact with blood or other bodily fluids, which can occur when sharing needles or other injection drug use equipment. Hepatitis C is the most common blood-borne infection in the United States. HIV, and less often HCV, can also be contracted during unprotected sex, which drug use makes more likely. The Diagnostic and Statistical Manual of the Mental Health Disorders, 5th edition, describes opioid use disorder as a problematic pattern of opioid use leading to problems or distress with at least two of the following occurring within a 12-month period: taking larger amounts of taking drugs over a longer period than intended, persistent desire or unsuccessful efforts to cut down or control opioid use, spending a great deal of time obtaining or using the opioid or recovering from its effects, craving or a strong desire or urge to use opioids, problems fulfilling obligations at work, school, or home, continued opioid use despite having reoccurring social or interpersonal problems, giving up or reducing activities because of opioid use, using opioids in physically hazardous situations, continued opioid use despite ongoing physical or psychological problems likely to have been caused or worsened by opioids, tolerance, the need for increased amounts or diminished effect with continued use of the same amount, experiencing withdrawal, opioid withdrawal syndrome, or taking opioids or a closely related substance to relieve or avoid withdrawal symptoms. Opioids can lead to physical dependence within a short time frame, as little as 4 to 8 weeks. And if opioids use stopped abruptly, can lead to severe withdrawal symptoms, likened to the worst flu symptoms you have ever had times 100. Individuals that are living with opioid use disorder desperately need to continue opioid use to avoid the severe withdrawal symptoms. More than half of people misusing opioid medications report obtaining them for free or stealing them from a friend or family member, going to multiple doctors to get additional prescriptions, filling prescriptions at different pharmacies so that no one will notice how many pills they get each month. And opioids produce high levels of the positive reinforcement or feel good neurotransmitter dopamine, increasing the odds that people will continue using them despite negative resulting consequences. What is neonatal abstinence syndrome? Neonatal abstinence syndrome is a neurological excitability, gastrointestinal dysfunction, and autonomic dysfunction. 12 newborns with NAS are more likely than other babies to have low birth weight and respiratory complications. 15 in every 1,000 babies born in Pennsylvania in 2016 to 2017 suffered from withdrawal exposure from illicit or prescription drugs. Drugs and alcohol, legal and illegal substances pass through the placenta directly to the baby, and dependencies formed quickly. Newly born babies experience withdrawal symptoms soon after birth, with symptoms lasting up to 6 months of age. Withdrawal symptoms can include seizures, tremors, excessive and high pitched crying, sleep disturbances, rigid muscle tone, hyperreflexes, stuffy nose, poor feeding, vomiting, diarrhea, dehydration, sweating. Oftentimes, preterm labor is a result of drug misuse, and low birth weight and prematurity compound the issues these tiny beings already face. Lasting effects of NAS on the infant can include birth defects, delayed growth, developmental delays, learning and behavioral disabilities, and respiratory problems. And unfortunately, babies born with NAS are more likely to end up in the foster care system. 90% of people with addictions started using substances in their teen years, beginning at age 10 through the mid to late 20s. Massive changes are underway in the brain. This includes the development of capabilities related to impulse control, managing emotions, problem solving, and anticipating consequences. Substance use during this time period can prime the brain to be more susceptible to addiction and other mental health disorders, especially for kids who are vulnerable. Some of the signs of opiate misuse include drowsiness, nodding off, impaired mental function, confusion, slow respiration, pinpoint or constricted pupils, lack of appetite, lack of motivation, poor hygiene, constipation, loss of interest in life, and mood changes. There are also physical signs of opioid misuse or heroin use, torn cotton swabs, cotton balls, or cigarette butts with the cotton pulled apart, water bottles, cups of water, and bottle caps lying around, missing and or burnt spoons, wax bags in many colors, oftentimes with a stamp, tiny clear or colored bags, cut up straws, needles or orange needle caps, missing money or valuables. If you suspect one of your loved ones is using an opioid or heroin, take a deep breath and set yourself up for success by creating a safe and open, comfortable space to talk. Don't start a conversation when your loved one is intoxicated or under the influence. Hold off until everyone has a clear head. Get on their level. If your loved one is sitting, you want to be sitting. Turn off all phones and devices and step away from other distractions. Avoid interruptions while you're talking. Think about your goals for the conversation. Consider writing them down to review how effective the conversation was later. Try to put any panic or anger aside. If you're anxious, find a way to calm yourself beforehand, like taking a walk or speaking with a friend for emotional support. Whatever you do, remain calm. As angry or frustrated as you feel, keep reminding yourself to speak and listen from a place of love, support, and concern. Try to stay relaxed as possible throughout the conversation. Avoid overreacting to what has already happened. Instead, focus on what you want for your loved one in the future. Watch your tone of voice. You may want to scream and yell, but it's important to maintain the calm and avoid pushing your loved one away. Your body language counts. Try a relaxed, open posture and avoid large gestures or crossed arms. Listen as much as you talk, and be sure to back and forth and not a lecture. Try not to make or take criticism personally or get defensive. Let it be an opportunity for further discussion. Focus completely on your loved one. Try to see things from their point of view, which will help you better empathize. Recognize when you don't have the energy to be a good listener and agree to restart the conversation at a later or better time, and then start talking. You've collected your thoughts and steeled your nerves, but how do you actually start the conversation? And more importantly, how do you get your loved one to talk? Express how much you care. Explain that the reason you're talking and asking questions is because you want them to be healthy, safe, and happy. Let your child know you value their honesty and are willing to listen without judgment. Ask open ended questions. These are questions that elicit more than just a yes or no answer. And let them know you're listening. Reflect back what you're hearing by rephrasing and asking for input, such as, did I get everything? Or with nonverbal cues like nodding or smiling. Offer empathy and compassion. Demonstrate understanding and show your loved one you get it. Clearly state any evidence you found and then give lots of praise and positive feedback. Be assured that you can always be counted on for support and that your loved one can confide in you whenever needed. Physical connection is important. Put a hand on your loved one's shoulder or give a hug when it feels right. And listen, sometimes they just need to get things off their chest. But be aware that your loved one could be hiding their true feelings out of fear, embarrassment, or something else. Listen between the words. Pay attention to body language, facial expression, and your loved one's difficulty in finding the right words. Thank your loved one for talking with you. Even if the conversation didn't go exactly as planned, your gratitude will make your loved one feel good and shows it was important to you as well. Work through the barriers. It can be difficult to get past a flat out denial of substance use. Some loved ones can't bear to take responsibility for the behavior and want to look good at all costs. Focus on the behavior that you've observed and why it worries you. Don't make it sound like you think your loved one is a bad person because they've tried substances or misusing substances. If your loved one is preoccupied with framing this discussion around trust, keep emphasizing your concerns for their health and safety. Insist on the value of the truth telling Explain that people trust you more when you are honest. Think about how you could verify any questionable claims. Um, and then, if you have objective proof that your loved one is lying, bring it up, but try not to make it as a triumph. It's not about proving they lied to you, it's about keeping your loved one safe. Try to find out why they lied instead of going straight to reprimanding them. Consider granting immunity. Some loved ones get caught in a web of lies and can't get out. You can sometimes help by offering a chance to clear the record. Allow an opportunity to tell the truth, free from any immediate consequences. And then in the future, acknowledge and reward their honesty. You want to keep an open dialogue. Have you succeeded in having a productive conversation? Give yourself a well deserved pat on the back, but don't stop there. Keep the dialogue open. Review the goals you had for your initial conversation. Which ones were met and which ones will you save for a later date? Reflect on what went right and what went wrong during each conversation so that you can make improvements for next time. Make a list and tackle any follow up items that you may need to work on. And have regular check ins where you discuss the rules and consequences in place and how they are working for everyone. Properly storing and disposing your medications can be a preventative step in opioid misuse. Remove drugs from your medicine cabinet and hide them, lock them up, or take them out of your house. Safeguard all medicines that have to remain at home by monitoring the quantities and controlling access. Take inventory by writing down the names and amounts of medications you currently have and regularly check to see if anything is missing. If you have a child and he or she is prescribed medication, monitor the dosages and refills. Set clear rules such as not sharing and always following proper dosages and warn them about taking prescription or over the counter drugs without a doctor's supervision, and that it can be just as dangerous and potentially lethal as taking street drugs. Supervise your child's internet use, as many pharmacy sites are not regulated. Properly dispose old, expired, or unused medicines by calling your local police department or the Pennsylvania Get Help Now number for take back locations. Do not flush medications down the drain or toilet as it is harmful for the environment. The Pennsylvania Get Help Now number is available 24 hours a day, 7 days a week. If you or a loved one needs help or have questions about opioid use disorder, please contact them now. The Partnership to End Addiction provides personalized support and resources for families impacted by addiction. Parent coaches are volunteers who have been personally affected by a family member's substance use or addiction. Some have loved ones in recovery, some have lost loved ones, and some have loved ones who are actively using in their addiction. Thank you for joining us today.